The annual Sullivan family reunion was supposed to be a celebration, but this year it had turned into a public dismissal of my ongoing cancer treatment. At 31, I was apparently the family member who made everything about her health problems, while my cousin Jessica was the shining success story with her new pharmaceutical sales position. Honestly, Katie, you've been going to these doctor appointments for months, my Aunt Linda said loudly enough for half the picnic to hear. At some point, you need to just get on with your life instead of making your health the center of every conversation. I was sitting at the family reunion pavilion in Riverside Park, trying to enjoy what might be one of my last gatherings before my upcoming stem cell transplant. The leukemia diagnosis had come 6 months ago, but my family had consistently minimized the severity of my condition. It's just routine monitoring, Dad had announced to relatives who asked about my frequent medical appointments. Nothing too serious. Katie's always been a bit of a worrier about health stuff. Mom nodded in agreement. The doctors are just being extra cautious. You know how modern medicine is, they want to check everything constantly. What they didn't know was that while they'd been dismissing my health anxiety, I'd been quietly serving as Director of Patient Advocacy for the Regional Healthcare Ethics Board. My background in healthcare administration had led to my appointment overseeing treatment protocols and patient care standards across 4 major medical centers, including St. Mary's Hospital where I was receiving my cancer care. Katie, Jessica just got promoted to Senior Pharmaceutical Representative, Aunt Linda continued. She's traveling to medical conferences, building real professional relationships. Maybe you should think about getting back to work instead of focusing so much on medical appointments. Jessica smiled condescendingly. I mean, I understand wanting to be thorough, but at some point you have to trust that if something was really serious, the doctors would be more aggressive about treatment, right? Exactly, Uncle Mike chimed in. If this was actually urgent, they wouldn't be scheduling you for routine visits. They'd have you in the hospital immediately. I took a careful sip of water, managing my nausea from the latest round of chemotherapy. Actually, I am scheduled for extended hospitalization next month. See, Dad said to the gathered relatives. A little hospital stay to get everything checked out. Probably just a few days of tests. Dad, it's a stem cell transplant. I'll be in isolation for at least 6 weeks. Stem cell transplant? Aunt Linda's voice carried skeptical surprise. That sounds very dramatic. Are you sure the doctors aren't being overly aggressive? Jessica leaned forward with her pharmaceutical sales expertise. I actually know quite a bit about oncology treatments from my work. Stem cell transplants are usually reserved for very advanced cases. Most leukemias respond well to standard chemotherapy. That's what I've been saying, Mom interjected. Katie's doctors seem to be taking a very aggressive approach for what's probably a manageable condition. Uncle Mike nodded knowingly. Medical industry loves these expensive procedures. They probably see a young woman with good insurance and start recommending premium treatments. The timing is terrible too, Aunt Linda added. Jessica's wedding is in 2 months and we've planned that Mediterranean cruise for Christmas. If you're going to be stuck in the hospital for weeks, you'll miss all the family celebrations. Maybe you should get a second opinion, Dad suggested. Find a doctor who might recommend something less disruptive to everyone's plans. I watched my family debate my cancer treatment like it was an inconvenient vacation scheduling conflict. The irony was overwhelming. I spent my days advocating for patients whose families didn't support their medical decisions, and here I was experiencing it firsthand. My phone buzzed with a text from Dr. Amanda Chin, my oncologist. Katie, the ethics committee meeting you requested is confirmed for Monday. Sunday evening, my family gathered at my parents' house for their traditional reunion wrap-up dinner. The conversation inevitably returned to my upcoming medical treatment, with everyone offering increasingly confident opinions about my oncology care. I've been thinking about your situation, Jessica announced over dessert. I spoke with some of the oncologists I work with in pharmaceutical sales. They said stem cell transplants are really only necessary for the most severe cases. Which confirms what we've been saying, Dad added. Your doctors are probably being overly cautious. Aunt Linda nodded emphatically. I found this article online about leukemia patients who chose alternative treatments instead of aggressive medical interventions. Many of them are doing just fine. Alternative treatments? I asked carefully. Dietary changes, stress reduction, natural immune boosters, Uncle Mike explained. The human body has incredible healing capabilities when we give it the right support. Mom pulled out her phone. I bookmarked several success stories. People who refused chemotherapy and focused on holistic approaches. The point is, Jessica continued, you have options. You don't have to accept the first treatment plan they offer. Especially something as extreme as a stem cell transplant. Jessica's right, Aunt Linda agreed. Medical professionals often push the most expensive, invasive treatments because that's what generates revenue. I felt my medication-related fatigue growing worse, but I needed to understand how far this was going. So you think I should refuse the transplant? We think you should explore all your options before committing to something so disruptive, Dad said carefully. Get multiple opinions. Research alternative approaches. The timing really is inconsiderate, Mom added. Missing Jessica's wedding and the Christmas cruise because you're isolated in a hospital seems extreme. Maybe the transplant could be postponed until after the holidays, Uncle Mike suggested. Give you time to try some less invasive approaches first. Jessica leaned forward with her pharmaceutical expertise. I could connect you with some oncologists who specialize in conservative treatment protocols. Doctors who don't immediately jump to the most aggressive options. That would be wonderful, Aunt Linda said. Sometimes you need medical professionals who think outside the box. What if the transplant is actually necessary? I asked. Then it will still be necessary in 6 months, Mom said confidently. Leukemia doesn't move that fast, right? You've got time to explore other options. Plus, if you spend the next few months focusing on natural healing approaches, you might not need the transplant at all, Aunt Linda added optimistically. Uncle Mike nodded. The body wants to heal itself. Sometimes we just need to get out of its way instead of bombarding it with aggressive medical interventions. I really think you should consider postponing, Jessica said. Give yourself time to research alternatives and see if there are less disruptive treatment options. And honestly, Dad added, if this was really urgent, wouldn't your doctors be more insistent? The fact that they're willing to schedule it for next month suggests there's flexibility. Mom smiled encouragingly. We just want what's best for you, sweetheart. Sometimes families can see the big picture when patients are too focused on medical fear. Medical fear? I repeated. When you're worried about your health, it's easy to accept whatever the doctors recommend without questioning whether it's really necessary, Mom explained gently. We're trying to help you think clearly about your options, Aunt Linda said. Sometimes outside perspective is valuable when you're dealing with health anxiety. As I listened to my family reframe my cancer treatment as optional medical drama driven by anxiety, I thought about Monday morning's ethics committee meeting. Dr. Chin had been growing concerned about the family pressure I was receiving to delay or refuse treatment. What my family didn't know was that as director of patient advocacy, I'd seen too many cases where family interference led to delayed treatment and preventable deaths. Tomorrow's committee meeting would formally document how their minimization of my condition was creating barriers to appropriate medical care. I'll think about everything you've said, I told them quietly. That's all we're asking, Dad said, patting my hand. Just keep an open mind about your options. Monday morning was going to be very educational for everyone involved. Monday morning, the Regional Healthcare Ethics Committee convened in the conference room at St. Mary's Hospital. As Director of Patient Advocacy, I'd requested this formal review of how family interference was affecting my treatment plan as a cancer patient. Dr. Amanda Chin, my oncologist, presented first. We have a 31-year-old patient with acute lymphoblastic leukemia requiring immediate stem cell transplant. However, her family is actively discouraging treatment compliance. Dr. Robert Martinez, Chief of Ethics, reviewed my file. What specific concerns has the family expressed? They believe the treatment is optional, overly aggressive, and primarily motivated by profit rather than medical necessity, Dr. Chin explained. They've suggested the patient pursue alternative treatments and delay the transplant until after family celebrations. And what's the medical reality of delayed treatment? Without stem cell transplant within the next month, the patient faces significantly increased risk of treatment-resistant relapse and potential death within 6 months. Dr. Sarah Williams, the patient rights specialist, looked up from her notes. So the family is encouraging the patient to refuse potentially life-saving treatment because it interferes with social events? Correct. They've also expressed concern that the treatment timeline interferes with weddings and vacations they've planned. Dr. Martinez turned to me. Katie, as the patient, how has this family pressure affected your treatment decisions? It's created significant emotional distress. I'm being told that my cancer treatment is optional medical drama and that I'm being manipulated by doctors into unnecessary procedures. Has your family attempted to influence your choice of medical providers? Yes. They want me to find doctors who specialize in conservative treatment protocols and avoid aggressive medical interventions. Dr. Williams consulted her tablet. I see you've submitted documentation about your professional background. Can you explain your role in healthcare administration? I serve as Director of Patient Advocacy for this ethics board. I oversee treatment protocols and patient care standards across 4 regional medical centers. The room went quiet. Dr. Martinez looked surprised. You're Katie Sullivan? The director who developed our family interference protocols. Yes. I've spent 3 years creating guidelines to protect patients from family pressure that could delay appropriate medical care. Dr. Chen leaned forward. Are you saying you're experiencing the exact situation your protocols were designed to address? I'm experiencing family members with no medical training telling me that my oncology team's treatment recommendations are unnecessary and motivated by profit rather than patient care. Dr. Williams pulled up additional files. You developed the Family Medical Interference Assessment Scale we use to identify cases where relatives are undermining patient treatment decisions. I did. And my family's behavior scores 8 out of 10 on that assessment scale. Dr. Martinez reviewed the documentation. Your family is actively discouraging compliance with oncologist recommendations for a life-threatening condition because the treatment timeline conflicts with social events? They've suggested I postpone stem cell transplant until after Christmas cruise plans and a wedding celebration. And they believe your leukemia treatment is optional? They think I'm being overly dramatic about a manageable condition that could be treated with dietary changes. Dr. Williams made notes in her file. This represents a clear case of family medical interference as defined in your protocols, Katie. I've been advocating for patients in exactly my situation while experiencing the problem firsthand. Dr. Martinez nodded grimly. This ethics committee officially supports your oncology team's treatment recommendations. The ethics committee's decision was swift and decisive. By Tuesday afternoon, Dr. Chen had contacted my family to inform them that their interference with my cancer treatment had been formally documented as a barrier to appropriate medical care. Katie, what's this about an ethics committee? Dad called Tuesday evening, his voice tight with confusion. The hospital reviewed how family pressure was affecting my treatment decisions. Family pressure? We were trying to help you consider all your options. You were trying to convince me to delay potentially life-saving treatment because it interfered with vacation plans. Mom's voice came through the speakerphone. We just wanted you to get second opinions before committing to such an extreme procedure. I got multiple opinions. From the entire oncology team. But Jessica said. Jessica sells pharmaceuticals. She's not an oncologist. Uncle Mike's voice joined the call. Katie, we're just concerned that you're not thinking clearly about this. Uncle Mike, I work in healthcare administration. I literally oversee treatment protocols for cancer patients. The silence was deafening. What do you mean? Aunt Linda finally asked. I'm the Director of Patient Advocacy for the Regional Healthcare Ethics Board. I develop guidelines to protect patients from family interference that could delay appropriate medical care. You work in healthcare? Jessica's voice was small. I've been Director of Patient Advocacy for 3 years. I oversee oncology treatment standards at 4 major hospitals, including St. Mary's where I'm receiving my cancer care. Dad's voice was strained. So when we were suggesting you find different doctors, you were telling a healthcare director to ignore her oncology team's recommendations for a life-threatening condition. The ethics committee's documentation had been clear. My family's behavior represented textbook medical interference that could have resulted in delayed treatment and preventable death. Wednesday morning, I began pre-transplant preparations at St. Mary's Hospital. My family sent flowers with apology cards, but maintained their distance during my recovery. Dr. Chen later told me that my case had become a training example for residents about family dynamics and medical decision-making. 6 months later, in complete remission, I was back at work protecting other patients from the exact interference I'd experienced myself.